Welcome to our exploration of the etiology of major mood disorders. Mood disorders, such as depression and bipolar disorder, are complex conditions that affect millions worldwide. Understanding their causes is crucial for effective treatment and support. In this video, we'll break down the biological, psychological, and social factors that contribute to these disorders. Let's begin by defining what mood disorders are and why their origins are so multifaceted. This foundation will help us appreciate the interplay of genetics, brain chemistry, and life experiences in shaping mental health. Major mood disorders include conditions like major depressive disorder and bipolar disorder. These illnesses are characterized by significant disturbances in mood, energy, and daily functioning. People with these disorders may experience periods of intense sadness, elevated mood, or both. Recognizing the symptoms is the first step toward understanding their underlying causes. In the next scenes, we'll look at the different factors that can lead to the development of these conditions, starting with genetics. Genetics play a significant role in the development of major mood disorders. Research shows that these conditions often run in families, suggesting a hereditary component. Twin and adoption studies have found higher rates of mood disorders among biological relatives. However, genetics alone do not determine one's fate. Instead, they interact with environmental factors to influence risk. Understanding this genetic vulnerability helps us appreciate why some individuals are more susceptible than others. Brain's chemistry is another key factor in mood disorders. Neurotransmitters like serotonin, norepinephrine, and dopamine are chemicals that help regulate mood and emotions. Imbalances in these neurotransmitters are often found in people with depression or bipolar disorder. Medications that target these chemicals can help restore balance and improve symptoms. However, the exact mechanisms are complex and still under investigation. This highlights the importance of ongoing research in understanding mood disorders. Advances in brain imaging have revealed structural and functional differences in the brains of people with mood disorders. For example, areas like the prefrontal cortex and amygdala may show altered activity or size. These changes can affect emotional regulation and stress response. While it's unclear whether these differences are a cause or effect of the disorder, they provide valuable clues about the biological underpinnings of mood disorders. Hormones also play a role in mood regulation. Changes in hormone levels, such as those occurring during puberty, pregnancy, or menopause, can trigger mood symptoms. Disorders of the thyroid or adrenal glands may also contribute to mood disturbances. Understanding these hormonal influences helps clinicians tailor treatments, especially for individuals whose symptoms are linked to hormonal changes. Psychological factors such as personality traits and coping styles can influence the risk of developing mood disorders. People with low self-esteem, high levels of stress, or a tendency toward negative thinking may be more vulnerable. Early life experiences, including trauma or neglect, can also shape psychological resilience. These factors interact with biological vulnerabilities to increase or decrease risk. Cognitive theories suggest that the way we think about ourselves and the world can impact our mood. Negative thought patterns such as hopelessness or self-criticism are common in depression. Cognitive behavioral therapy aims to help individuals recognize and change these unhelpful thoughts. By addressing cognitive distortions, therapy can reduce symptoms and prevent relapse. Behavioral theories focus on how our actions and environment contribute to mood disorders. For example, a lack of positive reinforcement or rewarding experiences can lead to feelings of sadness and withdrawal. Behavioral activation, a therapy technique, encourages individuals to engage in enjoyable activities to improve mood. This approach highlights the importance of daily routines and social connections in mental health. Social environment plays a significant role in the development of mood disorders. Stressful life events, such as loss, divorce, or financial hardship, can trigger symptoms in vulnerable individuals. Supportive relationships and strong social networks, on the other hand, can protect against depression and anxiety. Understanding these social influences helps us see mood disorders as conditions shaped by both internal and external factors. Experiences in childhood can have lasting effects on mental health. Trauma, abuse, or neglect during early years increase the risk of developing mood disorders later in life. These adverse experiences can alter brain development and stress response systems. Early intervention and supportive environments are key to reducing the long-term impact of childhood adversity. Chronic stress is a well-known risk factor for mood disorders. Ongoing stress can disrupt the body's hormonal balance and weaken the immune system. Over time, this can lead to changes in brain chemistry and increase vulnerability to depression or anxiety. Learning stress management techniques is an important part of prevention and recovery. Socioeconomic factors such as income, education, and employment can influence mental health. People facing poverty or unemployment may experience higher levels of stress and limited access to resources. These challenges can increase the risk of mood disorders. Addressing social inequalities is essential for promoting mental well-being in communities. Culture shapes how we understand and express emotions. Cultural beliefs about mental health can affect whether people seek help and how they cope with symptoms. Some cultures may stigmatize mood disorders, making it harder for individuals to access support. Recognizing cultural influences is important for providing effective and respectful care. Major life changes, such as moving, starting a new job, or retirement, can be stressful and trigger mood symptoms. Even positive transitions can create uncertainty and challenge coping skills. Support from family and friends can help ease these adjustments and reduce the risk of developing mood disorders. Certain medical conditions, such as chronic illness or neurological disorders, can increase the risk of mood disorders. The stress of managing a health condition, along with biological changes, can contribute to depression or anxiety. Treating the underlying medical issue is often an important part of improving mood symptoms. Alcohol and drug use can both cause and worsen mood disorders. Substance use may alter brain chemistry and interfere with emotional regulation. In some cases, people use substances to cope with symptoms, creating a cycle that's hard to break. Addressing substance use is a key part of comprehensive treatment for mood disorders. Sleep problems are common in mood disorders and can also contribute to their development. Disrupted sleep patterns and changes in circadian rhythms affect mood regulation. Improving sleep hygiene and addressing sleep disorders can help manage symptoms and support recovery. Recent research suggests that inflammation and immune system activity may play a role in mood disorders. Chronic inflammation can affect brain function and mood. This area of study is still evolving, but it opens new possibilities for understanding and treating mood disorders. Mood disorders can affect men and women differently. For example, women are more likely to experience depression, possibly due to hormonal and social factors. Understanding these differences helps tailor prevention and treatment strategies to individual needs. Mood disorders can occur at any age, but certain life stages carry higher risk. Adolescence and older adulthood are particularly vulnerable periods. Developmental changes, life stressors, and social roles all influence risk during these times. Family relationships and dynamics can influence the development and course of mood disorders. Supportive families can help with recovery, while conflict or lack of understanding may worsen symptoms. Family therapy is often a valuable part of treatment. Traumatic experiences, including those leading to post-traumatic stress disorder (PTSD), are closely linked to mood disorders. Trauma can change how the brain processes emotions and stress. Addressing trauma is essential for effective treatment and recovery. Experiencing loss, such as the death of a loved one, can trigger mood symptoms. While grief is a normal response, prolonged or complicated grief can develop into a mood disorder. Supportive counseling can help individuals process loss and reduce the risk of depression. Some personality disorders, such as borderline personality disorder, are associated with increased risk for mood disorders. These conditions can complicate diagnosis and treatment, requiring specialized approaches for effective care. Advances in genetic testing are helping researchers identify specific genes linked to mood disorders. While this field is still developing, it holds promise for personalized medicine and targeted treatments in the future. Epigenetics explores how environmental factors can influence gene expression without changing DNA. Stress, trauma, and lifestyle can all affect which genes are turned on or off, impacting mood and mental health. Neuroplasticity refers to the brain's ability to adapt and change. In mood disorders, neuroplasticity may be impaired, affecting learning, memory, and emotional regulation. Treatments like therapy and medication can help restore healthy brain function. Some infections have been linked to changes in mood and behavior. For example, certain viruses or bacteria can affect the brain and immune system, increasing the risk of mood disorders. This area of research is still emerging. Nutrition plays a role in brain health and mood regulation. Deficiencies in certain vitamins or minerals, such as vitamin D or omega-3 fatty acids, can contribute to mood symptoms. A balanced diet supports overall mental well-being. Regular physical activity is known to improve mood and reduce the risk of depression. Exercise releases endorphins and supports healthy brain function. Incorporating movement into daily life is a simple yet powerful way to support mental health. Some medications, including those for physical health conditions, can have side effects that impact mood. It's important for healthcare providers to monitor these effects and adjust treatment as needed. Technology and social media can influence mood, especially in young people. While technology offers connection and information, excessive use or online bullying can increase stress and isolation. Finding a healthy balance is key. Where we live can affect our mental health. Urban environments may offer more resources but also higher stress, while rural areas can provide peace but sometimes less access to care. Each setting presents unique challenges and benefits. Strong support systems, including friends, family, and community, can protect against mood disorders. Social support helps individuals cope with stress and recover from setbacks. Building and maintaining relationships is an important part of mental health. Access to mental health care is crucial for prevention and treatment. Barriers such as cost, stigma, and availability can prevent people from getting help. Improving access ensures that more individuals receive the support they need. Education about mental health helps reduce stigma and encourages early intervention. Schools and workplaces can play a role in promoting awareness and supporting those at risk for mood disorders. Prevention strategies for mood disorders include stress management, healthy lifestyle choices, and building strong social connections. Early identification of symptoms and timely support can reduce the risk of developing severe mood disorders. Treatment for mood disorders often involves a combination of medication, therapy, and lifestyle changes. Each person's needs are unique, and treatment plans should be tailored accordingly. Collaboration between patients and providers is key to success. Recovery from mood disorders is possible with the right support and resources. Building resilience through coping skills, social support, and self-care can help individuals manage symptoms and thrive. Ongoing research and advances in treatment offer hope for those affected by mood disorders. As we learn more about their causes, we can develop better prevention and intervention strategies. Staying informed and connected is essential for continued progress. In summary, the etiology of major mood disorders is multifactorial, involving genetic, biological, psychological, and social factors. No single cause explains all cases, and each individual's experience is unique. Understanding these complexities helps us provide better care and support. Key takeaways include the importance of a holistic approach to understanding and treating mood disorders. Addressing biological, psychological, and social factors together leads to better outcomes. Remember, support and early intervention make a significant difference. If you or someone you know is struggling with mood symptoms, resources are available. Mental health professionals, support groups, and community organizations can provide guidance and assistance. Reaching out is a sign of strength. Thank you for joining us on this journey through the etiology of major mood disorders. By understanding the many factors involved, we can foster empathy, reduce stigma, and support those affected. Together, we can build a more informed and compassionate community.